a baby, aren't you?
Animal rescuer Sonia is waiting with a 14-year-old English Bull Terrier called Arnie.
So we rescued Arnie from the local pound. Arnie's coming in a really bad condition, and he really needs Scott to have a good look at him and make him better again, make him the handsome boy that he was.
Hello, Sonia.
Hi, Scott. How are you?
Great to see you.
And you. This is Arnie.
Hello, boy.
Come on.
Oh, he's an English Bull Terrier. He is. He is. Oh, my goodness. You are so handsome, aren't you?
Boy.
You are so handsome. Sonia wouldn't have known this, but I had a rescue English Bull Terrier when I was going through university. His name was Zed. We had a massive bromance. I absolutely adored him. So to see another one here that I can help today, I think it's really special. He's got a nice shiny coat. He's a little bit thin, isn't he?
Bit underweight.
Bit underweight, yeah. And anything else?
He's got problems with his ears and his teeth as well.
His teeth, yeah. Are they bad? Can I have a look at this side, Arnie boy?
Good
Oh,
boy.
yeah, they're horrible.
Then we've also got his paws.
Oh, ouchie, Archie, look at that.
Yeah.
Straight away, that dew claw's grown there.
Growing.
And then, oh.
He's got this huge lump.
Oh, my goodness me. That didn't grow overnight,
No.
so someone has literally just left that
I
to
mean,
grow.
how long would you say that's been there for?
Oh, probably a good year, I would say. I mean, it depends on what it is, and that's the real worry, is it could be something benign, it could be something horrendously malignant, so we won't know until we take it off.
It really is sad to see a dog come in at that age. For us, it's shocking, really. I mean, it's disgusting that people can abandon a dog at any age, but when they really need you and they're in such a bad way, I've got no words, really.
Who abandons a dog? I mean, he's given you all that love and attention and joy, and then at the tail end of his life, when he's got a few issues, dump him. Just heartless.
Too sad.
It's always very upsetting to see any rescue animal and understand why they have just been turfed out of a loving home. Arnie particularly is pulling at my heartstrings. I absolutely love them as a breed. I know what they're like. I know how loving and loyal they are. And his owners have gone, you know what, we've had our best years with him. We're going to turf him out. And it just angers me to the very core. I think I might take him with me, son.
Okay, I was hoping you'd say that.
Yeah.
Scott's going to take him back to Richmond. Him and his team are going to do some wonderful work on Arnie. Bye, darling. He has got a lot of things wrong with him at the moment, but if anyone can make him better, paws crossed, Scott can do that.
Let's go to Richmond, hey? Let's show off a big muscly boy. Yes, yeah.
Orlando, tell me the truth. Did you just give Coco some food under the table, yes or no? It's obvious you did. You are guilty as charged, young man.
Unlike Arnie, Coco the pug is a very much loved family pet.
It's definitely got a sibling vibe, their relationship. They don't just treat her like a dog, they treat her like an equal. If they're not with her, they miss her. When they come back from school, the first thing they want to do is see her. They kind of fight over who gets to have her. It's a lovin', general lovin'. Good girl.
But the bond is closest between Coco and Anna herself.
Yes. Our relationship is very intense. It is a love affair. I mean, we spend all our time together. It was important that I had to get a girl because I am the only woman in this house with 3 sons and my husband. I mean, she is like one of my children, as far as I'm concerned. I mean, she's my 4th child. You have to have a nap now, don't you, after all that eating? She likes the good life. She likes human food. She will bark at the TV if she doesn't like the show. She'll bark at my feet if she wants me to pick her up. So yeah, we kind of slightly have to sort of pander to her needs, let's say.
Anna is dreading her trip to the vets tomorrow. She will have to hand over her special girl for her spay operation.
It is going to be scary, kind of leaving her. I don't think I've ever actually left her before.
Coco might be unaware of the impending surgery, but she's lapping up all the extra attention.
Massaged, pampered, stroked, nestled on me. There's nowhere that you'd rather be, is there, young lady? She is little, she is a baby, and yeah, it's going to be a bit nerve-wracking. Good girl.
Come on, this way. Good boy, come on. Here we go. Come on.
Scott has arrived back
Come
at the
on.
Richmond clinic with
Come
elderly
on.
rescue dog Arnie.
Come on. Good boy. In you come. Hi, guys.
Hi, Scott.
Can I introduce you to a very special boy?
Arnie is
This
getting
is
a
Arnie.
warm welcome from nurse Nathan and receptionist Kirsty.
He is a rescue dog. Unfortunately, his owners, after having him for 12 years, 13 years, have decided that they're just going to dump him. He's an old boy with quite a few problems. Come on in. Go with Uncle Nathan. Here he is. Here he is. Come on in. All right. I've just put a call through to a really good friend of mine to help with Arnie's care, and she is very much a fellow bull terrier lover. Arie, well, she's always wanted to be a veterinary nurse, and I thought this was the perfect opportunity for her to have a spot of work experience with her favourite breed. What do you reckon she's gonna... She's gonna go sick for you. She is. She is. Arie, this is Arnie. Don't cry, you're gonna make me cry.
Hello, darling. When I walked down and saw him, it was a shock. It was memories. It was, mixed emotions, but he's such a sweetheart.
Ali's first dog was an English bull terrier called Ruck, and it was through him that she first met Scott. Ruck has since passed away, but Scott and Ali have been firm friends ever since.
He's beautiful, isn't he?
He's very gorgeous. It just brings all the memories flooding back. So you start thinking about your dog and all the history with Scott and just how sad I was to lose mine. I just wanted to meet the little fella and see if he was all right.
Go and put some scrubs on, my dear.
Excited.
Scott has another motive for calling Ali in today.
We need to talk about what
He's
we're going to
hoping
do
she
with this
might
boy.
even consider adopting the old dog once he's nursed back to good health.
What he needs is a mountain of love. This boy has been shortchanged and he needs love urgently. Ali has such empathy and such care for animals, and she really wants to make Arnie feel loved, which is possibly the first time in his life he's really felt it.
Ta-da!
Ah, look. Looks
now
more
I'm ready.
nasty already. Very
I am.
good. Right.
I'm ready to look after the fella.
Yes. So he has quite the litany of problems, and we need to just prioritise as his veterinary carers what we're going to do. All right. So to start with, have a look at this.
Oh.
Absolutely horrific.
Oh my God, it makes me so mad.
Also, you can see his toenails are very long. Very sad to know that he's got ingrown ones as well. Then last but not least is this is the piece that I'm most concerned about. Very vascular, very large, very nodular, all things which could suggest that it's something not very nice.
And if it is nasty, is it likely to be elsewhere?
It could well be. Yeah.
I volunteer with dog charities and it never stops making me sad how people can just abandon a dog. It's just a catalogue of neglect to me that people haven't taken their role as a dog owner and dog carer and, dog mum seriously.
All right, but let's sort this immediate issue out. I mean, look at that. It's gone right around.
Back into the pad. That must be agony.
Yeah. It just shows how amazing dogs are, that he is in constant discomfort and yet can still find love in his heart for us, even though humans
we do that to him.
Exactly. God, they're so big and thick. Yeah, classic bull terrier nails. There you go, mate. That's what healthy, normal-looking nails looks like. Much better. No more digging in. So already we've made his life better.
Absolutely.
The nail clipping was straightforward, but now it's time for the far more complicated removal of the nasty lump on Arnie's bottom.
The lump under his tail probably worries me the most because in older dogs, there are some fairly nasty types of cancer that can develop around the anus. Some of them, like carcinomas, for example, are incredibly malignant and if present, will be fatal very quickly. If you can pull his legs a little bit further back, I really want to see that sort of come right up to me. That's it. Great.
Arnie's surgery is about to begin, and already Scott is worried about the elderly dog.
He is breathing a little bit roughly, so we are concerned about the anaesthetic, and we need to just make sure we keep a very close eye on him. All right, I'm cutting now. You ready to go? So what I'm going to have to do is cut through the skin. Once I start cutting into it, I can see it is just bleeding everywhere. But thankfully for Arie, she was tough enough and she didn't faint. Dog okay, Nath?
Yeah, it's fine.
Here we go. This is going to come off now, likely. All right. Come on. There we go. There we have it. Nasty looking thing. And unfortunately, it's so big and so thickened that I wouldn't be able to say that we've got good margins so that we have 100% cure. But we need to send this up to the lab and the pathologist will tell us what kind of cells make this up and are they bad ones or is it just an abnormal growth of an old boy? Let's hope
And
it's
if
the
it's
latter.
a bad one, what you're saying is you might not have got it all.
That's right, and I can't take any more away because I'll then affect the ability for his bum to work. He'll be incontinent, which is yet another reason why I won't get a home, so.
I meet lots of rescue dogs. I've met rescue bull terriers, not many, but I haven't been involved in surgery and he's so neglected. He's such a mess. Who's going to take him?
Come on. He's been a right soldier, hasn't he?
He has. Love him.
The next few days here at the practice is going to be an agonising wait because we need to wait for the pathologist's report on Arnie's lump.
There you go.
Hopefully, if that comes back okay and it's not a nasty type of cancer, then we still have to put the poor old boy through yet another anaesthetic to sort out his horrendous teeth. And then we've got to find him a new home. So there's lots of question marks still to come in Arnie's future.
I know, it's just me. It's just me. I know.
I'd like to think that Ali's thinking about taking Arnie.
Darling, I know.
He is definitely twanging her heartstrings. And I think that he will be a very lucky boy if he gets to go home with Ali.
It's okay.
I think this is like his favourite thing, isn't it?
I know, just wants
getting
cuddles.
A day after surgery to remove a massive lump from his bottom, elderly rescue dog Arnie is recovering well.
It's a hard life, isn't it?
And nurse Reagan and receptionist Kirsty are making sure he's getting lots of love.
Having Arnie here has been amazing. We've all fallen in love with him. Any kind of bull breed, I absolutely love them. And he's just been quite a good addition to the practice.
The old dog's next round of surgery on his badly neglected teeth will be in a few days. Scott and his team are hopeful he will then be well enough to go to a new home.
Oh, good boy.
So Phoebe should be getting here pretty soon.
Yeah, how exciting for her. Cool.
A new
I'm
vet
really
is
excited to
arriving
meet
at the practice today, and Scott and nurse Reagan are waiting
Really
to welcome
excited to
her.
meet her. What's she like?
She's very nice.
Yeah?
Yeah, very wide-eyed, very keen.
Cool.
And sure to be very, very nervous. This is the first time I've ever employed a newly qualified vet. It's quite a big undertaking because they do need quite a lot of support. But at the same time, I met Phoebe last year. She came and saw practice here, and we really liked her. She got on well with my team, and that's really important to me, so I thought I'd give her a go. Ah, and here she is.
Hi.
Hey,
I'm Phoebe.
I'm Reagan. Nice to meet you.
Nice
How you
to
doing?
meet you.
Welcome.
Hello again.
How are you feeling?
Nervous.
Yeah.
But excited.
Good.
Yeah. It's nice to have Scott as a friendly face on your first day. I'm really glad that I did placements here, so at least I vaguely know my way around most of the staff and the buildings.
Well, we've got lots of exciting things lined up for you today.
But you're going to start me off easy, right? Vaccines, health checks.
We'll see. We'll see. You've done lots of learning. Now I
Yeah.
think you need to get your hands dirty.
Okay. Wish me luck.
Good luck.
Should we go walkies? Come on, good girl. Where are we going?
And it's not long before
gonna go
Phoebe's
here?
first patient arrives for her appointment.
Hi, Kirsty.
Hi, how are you?
I'm all right. How are you?
Yeah, good. You got Coco.
I've got Coco.
Phoebe might have been hoping for light duties first off, but she'll be starting with a surgery.
My pug Coco's being spayed. I know it's kind of a normal operation, but it's a bit stressful because it's my baby.
Yay. Yay. Oh, yes.
Hi, Anna. I'm Phoebe.
Hi, Phoebe.
Nice to meet you.
Nice to meet you too.
And this is Coco.
Yes, this is Coco.
Hello. Right, let's come through.
It might be only her first day on the job, but graduate vet Phoebe is quick to recognise canine blue blood.
Oh, she really is a little princess, isn't she?
Yes, you are. Well, apparently in China, they were only owned by the Chinese aristocracy and kings and queens, and they actually had their own servants.
So does Coco have servants?
I'm an unofficial servant. I do everything for you, don't I? Totally in your power, young lady.
Yes, I am. Yes. So what's Coco in for today?
Her spaying.
Her spay.
Spaying.
Are you nervous?
A bit, yeah. Just because it's an operation.
You have no problems with her health-wise?
No, she's fine. She's really healthy, loves walking, eats well. Actually, she did have a hernia.
A hernia?
She was little, quite a big one.
Okay.
We were told to monitor it, and it's kind of now disappeared. But I know that if you find it, you might be able to take it out in the spay.
Yeah, it's not there at the moment.
No, it's just completely disappeared.
But that is the thing with hernias, is that they can pop in and out. So definitely we can look at it while she's under, and if there is a hole, then we can close that up.
Okay.
She's going to be absolutely fine.
You'll be fine, young lady, won't you? Yeah? Good girl.
Anna dotes on Coco, and she was very worried about the surgery. So I hope we set some of her fears at rest.
Right, I'm going to leave you now, Coco.
Bye. We'll take good care of her.
Bye. Good girl. Go on.
You'll be back with your servants soon.
Yes, your servant and your mother and everything. Bye, lovely.
Bye.
It's going to be a stressful day. Until I get the call that she's okay, I'm going to be a bit on tenterhooks, I think.
Are they talking to each other? Yeah. They do talk to each other, don't they?
Scott's next two patients are in Hampton Hill. They're a pair of elderly tortoises that recently came to live with Simone and her young family.
They seem very hungry today, don't they?
A friend posted on Facebook that his parents were retired and that they were looking to rehome their tortoises, and would anybody be interested in having them? And I jumped at it. Yes, yes, please, please. We have a boy and a girl, Molly and Atwin. We haven't had them that long, and I absolutely adore them. And they've become a very, very big part of our life, like all of our lives, the kids as well.
Is he gonna like Apple?
The pair will be Scott's oldest ever patients. They're estimated to be over 100 years old.
We assume that they would have been brought over from Africa in between the world wars, the First World War and the Second World War, and they would have survived the Second World War in England somewhere, which is incredible. I was so excited to get them, and then suddenly was all scared about, but I have to look after them really carefully. People before me looked after them so well, then to brought them to this stage, I feel I can't sort of drop the baton now.
But recently, Simone has noticed male tortoise Atwin has a problem. So she's called Scott to check him out.
Hi, Simone. How are you?
Scott.
I can't wait to see my reptile patients.
Yeah, come in and meet them.
There's
one of the patients.
There he is.
He's walking quite quickly for an old timer.
They move quicker than you would expect. So,
Hello.
so this is Atwin. So this is the boy.
It's absolutely incredible, isn't it, to think that you're holding a 100-year-old animal.
I know. It's quite a responsibility.
Isn't it? It's great being a vet when you can go out and about and meet other animals, but particularly ones so old. A full 100 years, it does make them incredibly precious creatures. So I can see that discharge. How long has that been there for?
Probably about 2 or 3 weeks.
Okay. And do you think it's affecting him at all? I mean, is he coughing or sneezing or...?
Not that I've noticed.
No.
And he's eating lots, and
Eating
as you've
well.
seen, he's active.
Yeah. Okay. Having a general look at Atwin, he seems like a very healthy tortoise. But Ronnie knows in a tortoise, generally it's not just a simple cold like in people. In a tortoise, if left alone, it can become something more complicated, something like pneumonia. I think what's happened in this case, he's a new animal to you.
Yeah.
And I think during the process of movement from
Yeah.
the old to the new,
Yeah.
he's an old boy and they don't cope with change very well.
Yeah.
So I think he's probably got a little bit stressed and as a result has developed this condition.
Yeah. Oh, good boy.
There you go. After putting a couple of antibiotic drops into Adwin's nostrils, he looks wholeheartedly unimpressed, but as a 100-year-old, he's allowed to be a bit grumpy, but he seems very happy, and I'm sure he's going to make a full recovery. Good boy.
Give him a rest.
Yeah. All right, then.
Come on then,
Jump up in
buddy.
his bed.
Let me take you to bed. I'm very relieved that we got Scott around. Part of me initially was, it's just a bit of a runny nose. I don't want to waste his time. But I'm very glad that we did call him in.
So you've got another tortoise somewhere around here, haven't you?
She's just over there in the corner. Shall I go and get her for you?
Yeah.
Atwin's partner is a female called Molly.
So she's a lot heavier.
And is she equal in age as well?
Yeah, they've been together for about 80 years that we know of.
And do the old couple get on very well?
Yes, he can bother her at times. And
Bother? What do you mean?
How do I put it tactfully?
I don't know. What are you going to say?
So Atwin does harass Molly quite a lot, and their mating ritual is essentially to headbutt and bite. Occasionally, if he is being a bit rambunctious, I will bring him in the house or put him in a pen or just take him to the other side of the garden. But she doesn't actually seem that bothered.
I've gone for flowers before, but maybe I'll try headbutting.
Headbutting.
Yeah.
I've caught him on top of her a couple of times when we first had them, and then she laid some eggs.
Wow. Wow, you've got tortoise eggs.
I have tortoise eggs.
Oh, my goodness. You can't help but be really impressed that two old-timers are busily getting at it in Simone's garden. So whatever she's got growing here, it obviously works very well in that department.
So they're in here. We have 2 trays. That one has 3 in it.
Wow, that's amazing. Look at that. You can actually see that there is some density in there. So it could be a yolk.
Okay.
And a white, just like a normal chicken egg.
Yeah.
But that doesn't mean that it's naturally fertilized. But we know that these guys have been
busy
getting on the good foot and doing the bad thing. And as a result, there could be some tortoise babies in there. You never know. Well, they're doing well in this incubator. They're nice and warm. So let's get them back in there.
Lovely.
Good luck, little ones.
All fingers crossed. Hope that we possibly get some baby tortoises out of it.
You've totally got to invite me back when you get the pitter-patter of tiny little tortoise feet.
Definitely. Slightly panic call, no doubt.
Yeah.
What do I do now?
And I'll check on Atwin's snotty nose at the same time.
No, that'd be lovely. Thank you. Well,
No
thank
problem.
you for coming out.
Pleasure.
Thank you.
It's obvious to see that Simone is really dedicated to these tortoises already. She has real love for them. I think she has real respect for them, and she wants to do the best by them. So she's the perfect new owner for them, and hopefully they'll live a further long and happy life with her.
Hi, Jess. Hi, Phoebe. This is Coco. Hi, Coco. You all right? What's Coco here for? Coco's in for her spay today. Oh, you're so cute. You're so tiny.
At the Richmond Practice, Coco the pug is about to be spayed by graduate vet Phoebe, assisted by nurse Jess.
Yeah. I'm a bit nervous because I haven't done that many spays. I did a few as a student, but since graduating, I've only assisted on one, and this will be the first one, being the main vet making all the decisions. Look at that. Well done, puppy. Well done.
Coco also has a small hernia which Phoebe will be repairing.
Hello, ladies.
Hello.
And Scott has returned to the clinic
All right,
to
you've got
supervise
Coco.
both procedures.
Today I'm here just to lend a hand, to be a shoulder really for Phoebe as she embarks on this big journey of doing her first spay. It can be incredibly nerve-wracking, so I want to try and support her, to look after her and make sure she gets safely through this procedure, and so does Coco. How was Anna this morning? Was she fretting?
I told her she didn't need to be worried and that we take good care of her.
Yeah. Did you tell her how many spays you performed before you said that?
No, I kept that fact to myself, actually.
Well, that's okay. I've done quite a few, so don't you worry.
I know the theory of it and I've learned it 1,000 times, but it's just those tiny little things in practice that are just a bit different, like a bit extra fat obscuring the uterus, a bleeder where I wasn't expecting one, that means you need to be able to react quickly, and that's what I need to hone down my skills.
Go for it.
Jess, are you happy? Happy, yeah. Okay.
Every single vet coming out of vet school is incredibly nervous when it comes to their first spay. It makes your heart go. It really does give you palpitations. It's a very nerve-wracking experience, but it's a real rite of passage as far as being a new graduate vet. You've got your ovary at the end.
There's my ovary.
Okay. Now, the hardest bit for a new vet is to get used to how much tension you have to apply to break the ovarian ligament. And it's just about trying to feel confident with how much tension to apply to actually snap it. And it's always going to feel like more than you should. Can you feel the tension running up?
Yep, I can feel it stretching now.
Yep. And then you've got to just push down, snap.
Is she okay? Yeah. This is the most painful part of the procedure, isn't it?
For you or for the dog?
Both of us. It's stretching, it hasn't broken yet.
If you grab it, slightly twist your hand to the side, and then you can snap that way. Put that pressure downward, really go for it. Breaking?
Yeah, broken.
That's great, good job. I've seen vets struggle with that for years, so that's really good.
It's a bit nerve-wracking, but Scott was able to give me loads of helpful tips in spaying, and all of those are hopefully going to help me do my next spay quicker and easier.
So if you just start your second incision by just attaching it, just going over the hernia, lovely. Not only is Coco in for her spay today, but also she has an umbilical hernia, basically what we see in humans as an outie belly button. And that's just where the umbilical cord has detached from mum and the placenta. The abdominal wall hasn't closed properly. It leaves a hole and then a little bit of fat, and sometimes intestines can pop out. Phoebe's able to close up the skin really well, so no more hole and no more outie belly button. Done. Well done.
Thank you. Start to finish.
Very good.
Although I was very grateful for your assistance, Scott.
Very welcome. All right, now let's wake this princess up, shall we? Have we got her throne ready? Phoebe's done very well. I mean, this is a very nerve-wracking procedure for any new vet to do. She's jumped the hurdle and she's on her way. Well done. Oh, big stretch.
There we go. The surgery went really well. Coco's recovering. She doesn't have a hernia anymore. She doesn't have ovaries. I think we've done well.
Call your mummy.
In Richmond, it's time for Arnie's second surgery, this time to fix his badly neglected teeth.
Oh, look, who's that? Who is it? Who's that? Hi again. Careful.
Scott's invited Arie back to assist with today's surgery.
He's definitely happier. The wound at the back of his tail here, where we've removed the lump, is healing very nicely indeed. So nice assisting the other day. And even better news is the results have come back. And although it looked like an incredibly nasty tumour, it had the suggestion that it was going to become something nasty, but actually it's benign. So.
No way. Yes. Oh, mate. Just a nasty, horrible lump.
Yeah. Oh. More unsightly than dreadful. Yeah.
That's the best news.
Yeah. A little bit of sunshine in our boy's life.
But Arnie's good news is tinged with sadness. After Scott found out the poor old dog is deaf.
Stone deaf.
Stone deaf.
Yeah, he can't hear a thing. Nothing. Hey?
Scott and his team are now more determined than ever to give the brave bull terrier a better life.
Yeah, relaxed.
So now it's time to start his much-needed dental surgery.
Let's get you downstairs, my boy, and let's sort those teeth out. Although I'd love to give Arnie a Hollywood smile, this isn't a choice. I have to do this dental. His teeth are horrendous. There's a huge amount of bacteria and infection built up along his gum line, which will be having a major effect on not only his quality of life, but also the health of his liver and his kidneys. Hold your dental chart there, please,
Do I not
nurse.
need any gloves?
Well, we might get you pop on some gloves in a second.
Okay. Shall I fill his name in?
Yes, go for it. As Ali's here and she's a hard worker, I'm going to put her to work. So not only will she be my dental nurse for the day and help me to understand which teeth are going to stay and which teeth are going to go, but also she'll do a little spot of scaling and polishing. This is years worth of tartar that we're going to get rid of in an afternoon, which is quite satisfying, yeah.
God, you can be quite rough.
Yep. Doing a dental on a dog like Arnie is pretty dirty business. It's very grubby, it's quite bloody, and at times it's really quite rough as well. We have to put quite a bit of force in to remove some of the teeth that are loose and then scale all the nasty tartar that's been building up over a number of years. So 401 is loose, so that's going to come away.
8 of Arnie's teeth are badly infected and will have to be removed.
So when they come out that easily, they're meant to come out.
His gums are also in shocking condition.
Do you want the goggles?
And a thorough clean is needed to remove years of built-up tartar and plaque that's contributing to his gum disease.
It really must have been such a painful time. Every time he opened his mouth to chew, it must have been an exercise in discomfort. But now all that tartar's removed, just like when you go to a dental hygienist yourself, your teeth feel shiny and fresh, and that's exactly how hopefully Arnie will be feeling.
Oh boy, well that's the last thing you need to do. Hopefully you can have a lovely retirement now. Ready for a loving home. Do you know anyone?
I'm trying to be very subtle when it comes to Arie and maybe considering that she should take Arnie home with her. I'm not normally classed as subtle. My wife would say I'm like a brick through a window.
But Scott's not so gentle persuasion seems to be working.
He's a lovely boy.
He is, and when he's up, he's such a joy. Tail going.
He's a classic love sponge. You. Hey.
You could share him.
Maybe we dog share.
Yeah.
Gosh. You have to tell Zoe.
Hello, Coco. Time to go and see Mummy. There we go. Should we go see Mummy?
In Richmond, Anna and her 3 boys are anxious to see how their precious pug Coco has fared after her operation.
Here she is.
Hello, darling. Oh,
Little baby.
She's been really, really good.
Okay.
The surgery went really well. We managed to spay her and repair the hernia. She's recovered well and she's had some food.
Good girl, you're such a brave girl.
Anna's definitely delighted to have her little girl back in her arms. I think with all the crazy boys around, she needs a bit of sanity and a bit of girl power.
Yeah.
She's going to need some big brotherly love,
Yeah?
okay?
Thank you.
Thank
you very much,
That's
Phoebe.
okay, boys. I'm just glad she's all right.
Yeah, no, honestly, thank you so much.
No problem.
The princess is home and she's going to be treated like a princess for the next few days for sure. So yeah, that'll be easy for me to do. Movies, cuddles on the sofa, just chilling out with Coco and the boys, and she is going to be in charge. Girl.
Good boy. That's it. What a good old gent. Okay, now remember, best behaviour. Hey, mind your P's and Q's.
Today, Scott has brought rescue dog Arnie to a local park.
Walking down the hill with Arnie, immediately I get a little bit nervous. There's real trepidation because this is a make or break moment. Arnie has the chance of a new life with someone absolutely amazing. So I just hope this works, but I am very, very nervous.
Uncle Scott's on his way with a surprise.
Scott is hoping his good friend Arie will give Arnie a new home. But it all hinges on how well Allie's dog Mabel gets on with the old bull terrier.
I can see your potential new family over here. Come on.
My biggest priority is Mabel. I hope the meet and greet goes really well, but I need to be sure that I'm doing the right thing for her before I can do the right thing for him.
Hey, Al.
Hey there.
Who's this handsome guy?
Look at him.
Who's this handsome guy?
Gently.
Say hi.
Oh, look at him. There you go.
Aww. Oh, they're going to do a dance.
We're going to do the lead dance.
Arnie and Mabel lock eyes and love at first sight. Oh, look. I think that's the first time I've seen him do that.
Oh,
yeah.
Are you kidding?
No.
Oh, look. Mabel and Arnie seem to get along brilliantly.
Look at that.
Look at that.
Oh. Immediately, Arnie starts to play bow, which is a exhibition of happiness where they want to engage another dog in play behaviour. That's so, so positive. They start walking around and smelling each other, which is very normal for dogs. And then they get to a point where they're so comfortable in each other's company that they pretty much ignore each other. That is an ideal result.
That's brilliant, isn't it?
Very calm, very relaxed.
Yeah, I'm really happy with that.
Very happy, waggy tails. We really couldn't ask for anything better.
No.
The look in Allie's face shows how calm and how happy she is about the situation. Looking good.
He needs a good home. He hasn't had one, has he? And I think I can give him a pretty good home.
Yeah.
It feels kind of right.
So happy, so happy. So nice.
It might not be for a long time, but it'll be for a good time.
You'll be fed well and loved, sweets.
Yeah. And I'll be there, and you've got a personal physician.
That's it. The meet and greet went brilliantly. So, yeah, I'm really, really happy. I think he's found a home with me.
You're right there, Mabel. Hey? You're right there. Hey?
You're missing out, darling. Did you just
You're right. You're right there.
As Arnie's an old boy, he still needs a little bit more treatment before he's fully ready to go to his new forever home. So he's going to come back to the practice with me, but very soon I get to help this boy as he ventures forth into this wonderful retirement.
Happy families.
I hope so.
Right, let's come and find Atwin.
Yes, the obligatory search for the tortoise.
Scott's back at Simone's house to check up on one of his oldest patients, a
How's that runny nose
100-year-old
getting on?
tortoise with a runny nose.
He's doing a lot better.
Good. Well, his nostrils look nice and clear, don't they, champ? And no discharge, which is brilliant. Good stuff, my boy. Hey? Or sir, as I should say, considering how old you are.
I'm really glad to see that Atwin is back to full health and looking great. But I'm very curious about the fact that this old boy managed to procreate with his girlfriend and produce eggs. So what happened to them? I'm really interested to know.
Right, come through and I'd like you to meet Maisie and Daisy.
Wow.
These are our little tortoise babies.
Can I pick one of them up?
Yeah, feel free.
Hello, cutie. So which one's this one?
So that one is Maisie and this is Daisy. They're a week old today.
Yeah.
And we had the pleasure of watching them hatch out, which
Wow,
was
really?
amazing. When they were hatching, first of all, it was just a tiny little nose and a little face poking out. Slowly, one came out on its side, but the other one properly came out like a little dinosaur with its front paws first. And it was incredibly cute to watch.
You can do this, little fella.
I mean, they're absolutely fantastic. And to think that they've come from 100-year-old parents.
I know.
It's incredible.
I
isn't it?
really didn't think the eggs would hatch. I thought that was a real long shot.
These little creatures are so amazing and extraordinary, and I feel very honoured that I've been allowed to examine them for the very first time. But at some point in their life, they'll be examined by a vet that isn't even born yet, which is a bit frightening, but super cool at the same time.
And if we do everything right, there's no reason why my grandkids or even my great-grandkids might not be looking after these guys.
You guys have got a lovely future ahead.
We absolutely adore Maisie and Daisy. They've really become part of our family. A lot of friends have said, oh, are you going to rehome them and can we have one? It's like, no, they're ours to keep.
Graduate vet Phoebe is in Chiswick to check up on very special patient Coco and her doting owner, Anna.
Hi, Anna.
Hi, Phoebe. How are you?
I'm good. How are you?
I'm good. This young lady's very well as well.
Hello, Coco. I'm really excited to see Coco today. It's been a couple of weeks since she came in for her spay and her hernia repair. It was one of the first procedures I did since qualifying, so I'll be interested to see how the spay wound is healing. Right, should we have a little look at that scar then? Oh, wow, look at that. That looks really, really good. Got no recurrence of that hernia. It's nice and flat with the skin.
Yeah.
Yeah, there's no pain, swelling, discharge.
Oh,
No, that's really good. It's completely healed.
amazing.
Well done, Coco.
Having Phoebe come to see us is really important, obviously, because Coco is our fourth child, basically, our only daughter, even though she's canine. And it's just really important to know that she's okay and that nothing's wrong and that she's recovered.
You're all done. You can be signed off now.
Good.
Go back to playing how you want to.
Yes.
It was really great to see Anna again and see Coco. I'm really, really happy with her wound. It's all healed really nicely.
Go!
She can now go back to normal exercise, playing with her brothers and being full-time princess.
Go, go, go! Come on! Good girl. Phoebe made me feel, really happy about Coco's recovery. And I now know that I can take Coco out for a walk and, that she's happy and well. It means a lot to us. Coco, 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 come on! Come on! Good girl.
I will miss you. It's so lovely.
It's a milestone day for elderly dog Arnie. The 14-year-old rescue dog has undergone weeks of surgeries, medication and TLC. And today he's finally well enough to head off to his new home.
Hey guys, I was wondering where he was.
We just kidnapped him.
He's enjoying his favourite pastime of being adored.
Yeah, just making the most of its last few minutes here.
Yeah. Obviously, it's very sad for us to say goodbye to Arnie because we've all absolutely fallen in love with him, particularly some of the support staff, Kirsty and Reagan. They adore him. They've actually taken him on weekends to their own homes and given him all the love and the care and attention that we all pride ourselves on. So it is very sad that they have to say goodbye to him, but for Arnie, it's a great day because he gets to go to a loving new home. Come on.
Come on, then.
Come on, mate. Let's go to your new home. Come on, buddy. Good boy. Good boy. That's it. Come on. There you go. Let's go. Let's go.
Sad. I'm gonna miss now. I know.
Come on, then. Hey, chauffeur-driven to your new home. Come on. Arnie's been with us for a long time now. For him to go to his new home, obviously, is a really important step in his future. But for us, we're left with a big hole. He has been such a wonderful personality to have in the building, and we're going to miss him very much. Okay, mate, let's go. Boys on tour. Yeah?
Big brother's coming today. Yes, he is.
At Arnie's new home in Surrey, an excited Arie is waiting with her other rescue dog, Mabel.
Mabel doesn't have a clue what's coming. But I think when he arrives, she'll think he's going to stay for a bit and then leave. It's just the bond between the two dogs. You're never really sure until, you're in the home environment. There's a tiny little bit of anxiety there. The rest of it is just excitement.
Okay. Come on then, handsome. We're here. There we go. Good boy. Come on then. Come on then. Come on, this is your new home. Hello, mate.
Hello, mate.
Hello, look.
Hello,
your new
fella.
friend. Look.
I know you can't hear me, but hello, fella.
Hello, Here's your new boy.
Hello, fella. God, Scott, he's looking so well.
I know.
You've put on a few, well, I don't know how many kilos.
He's put on 4 kilograms.
4.
He's put on 1 kilogram a week. So he's just doing so well. And now you get to enjoy the high life with Arie.
Welcome home, treasure. Hey.
It's an incredible full journey that we've had with Arnie. He's gone from rescue, we've rehabilitated him, had 2 major operations, and now he's going to be released back into the wilds of beautiful Surrey with Arie. He's going to have such a wonderful twilight of his life, and the fact that I've been able to play a part in that is really special for me. Go on, old man. Go on, you can do it.
So he's home. He's home here with us, with Mabel. He seems pretty relaxed. Mabel seems pretty relaxed. That's it. What a perfect day one.
So nice to just see him in a garden alley.
Oh, love him.
I know. He's so lovable. He's so lovable. Hey, Dan, so what have you got?
Hey, we've just picked up a little seal pup from over there. We've just moved it up because of the tide, but
okay.
We'll give it a check over now if you're ready to jump on it.
Yeah, absolutely, yes.
Dan is the Field Support Officer for British Divers Marine Life Rescue, a volunteer organisation dedicated to rescuing marine animals found in distress around the UK.
Just turn him around a little bit.
It's like a young one.
It is, yeah, quite small as well, so here we go. Just pop that towel over it.
Oh, hello, beautiful.
Probably about in the range of 6 weeks, something like that.
I think. Yeah, you're quite a thin girl, aren't you?
That's right.
While I'm sitting on this girl, I can really feel how bony and thin she is. I can feel her ribs and her spine. She just doesn't have the fat coverage that she should at this stage in her life.
The seal pup will have to be moved off the beach. But first, she desperately needs rehydration.
Here you go.
Okay. All right, so sweetheart, this is not going to be very nice, but it's all for a good cause. So we've got sort of a nice energy drink there for her, yeah? Full of electrolytes and fluids.
It is.
Good girl. It's okay.
There we go. Taking that quite nicely. And these rehydration fluids will help just give her a little bit of energy, perk her up a little bit for the journey to the seal sanctuary where we can get her some care and antibiotics. So the rear right flipper here is looking pretty good.
Yeah.
Can't really see any injuries on there. There's a tiny little graze just here. And then same on this flipper here, a little bit of a bigger wound.
Oh, ouch.
Just there.
Yeah.
That's probably
a bite for sure, doesn't it?
Yeah.
My heart really goes out for this poor seal pup. I mean, only a few weeks ago, she would have been with Mum, getting a lovely meal of milk very regularly throughout the day. Then she got weaned and things have gone from bad to worse. She's not been able to hunt. She's been bitten on one of her flippers. Then she's been dehydrated, starved, and then thrown onto the beach. So life has not been too fair for this poor girl.
There you go.
That's it. I'll bring her ear end over.
All right, good girl. Sit. In you go. Here we go.
That's it.
The next step is to get this pup to the nearby Cornish seal sanctuary as quickly as possible for more emergency treatment.
Perfect.
Good girl.
Oh, Dotty!
Back in London, Scott's receptionist Elle is worried about her new family pet.
Who loves their food? Dotty. Dotty does.
I've got a new Dachshund called Dotty. She's a rescue from Dogs Trust and she's 4 months old.
Dotty, come on. Where is it?
Elle and daughter Lucilda adopted Dotty after looking after a friend's dachshund and falling in love with the breed.
Dotty, what's he doing?
Oh my goodness, the Dachshund breed are incredible. They're little characters, they can be very stubborn, they're cheeky, they're energetic, and they just love to play, and the children love Dachshunds. You can pick them up, carry them everywhere. They can go on long walks, just everything. She is a big, big part of the family.
But Elle fears the little pup may have had a tough start.
I know a little about her past. She was found in a van at Dover Docks with lots of litters of puppies that had come from Europe, and it had been seized.
With no details about her medical history, Dotty is booked in for an appointment with vet Phoebe to make sure she doesn't have any serious health issues.
You have to be careful, they've got very long backs. I want Phoebe to just check the length of her back and her patellas, especially in the back legs, and just check her out completely to make sure she's okay. Good girl.
Back in Cornwall, Scott and Dan have arrived at the Cornish seal sanctuary with the injured pup. And waiting for them is animal care supervisor Claire.
Hey, Claire.
Hi.
How's it going?
All right. Hello.
So we've got a very beautiful female seal for you. She seems only a few weeks old, really quite thin,
Shivering.
quite weak, a little bit dehydrated with the dry eyes, and she's got a bite wound on her right rear flipper and an abrasion on her right foreflipper.
Okay.
So now you've got to get her straight into the hospital, but first things first, you've got a very important white gown on for a good reason, haven't you?
Yeah, so we'll just quickly test her for avian flu, and once she's passed that, she can come straight up to the hospital and we can start treating her straight away.
Nice. Sounds exactly what she needs. All right, then. Avian flu is most commonly associated with birds, of course, but seals are also at risk of contracting the virus. It's a highly contagious and sometimes deadly condition. So if this girl has it, then we can't risk taking her into the hospital and coming into contact with other seals.
That's it. Thank you.
So I know that she needs a name to go into the hospital, and I just think she's so incredibly beautiful.
There is a word that we can use which might suit her, which is Gwinny or Gwinny, perhaps for short.
Okay. There you go, Gwinny. What do you think? She says, I don't care. I don't care what you call me. I'm hungry and I'm cold.
Pretty much.
Well, now your name's Gwinny, you can come to the hospital. Hopefully that avian flu test has come back negative. Hey, baby. How's it looking, Claire?
Yeah, it's all negative. So
All negative?
we're ready to go.
Awesome. Okay, let's get this girl into the hospital then, shall we?
Excellent. Gwinny. Might not look too bad right now, but she might just be hanging on to that last little bit of energy to keep her going, but she could really crash at any moment if she just loses all of her energy. So it's quite important we move really quickly now.
Okay then, Dan, thanks a lot. Okay, Gwinny, let's go. Let's get into that hospital, sweetheart. So, where is she going in here?
Yeah, just pop her in here and then we'll just need to change her wellies.
It's just a short distance up to the hospital, and straight away Scott and Claire can start work on Gwinny.
So, the broom technique, yes?
Yeah, over the shoulder.
Okay.
A weigh-in will provide important clues about the young seal's condition.
So, including the cage, it's 26 kilograms. So the cage is how heavy?
It's 14 and a half.
14 and a half. Okay, so that means she's 14 and a half, so she's 11 and a half?
Yeah.
But that's a very, very light seal, isn't it?
Yeah, incredibly light.
Yeah.
At this age, she should be about 25, 26 kilos at least.
So she's less than half the weight she should be.
Very, very
Gwinny,
small.
gee, you really have fallen on hard times. Let's settle you into your new dig, sweetie. Come on.
11 and a half kilos. She's one of the smallest that we've had in this year. Very, very skinny. You can see her hip bones and you can see her ribs. So yeah, very malnourished.
So Claire, lots of clothing changes and boot changes here at the sanctuary. They're really important, aren't they?
Yeah, definitely. We have to make sure that anything that she has doesn't get transmitted to the whole hospital. So it's very important that one set of wellies, one set of overalls, and one set of jackets for one pup.
Yeah, because one set of germs doesn't want to spread to another pup.
Yeah, definitely.
All right, let's start your exam, sweetie. Okay. It's all right. It's all right.
It's okay.
Very good. So first things first, I should just take her temperature, hey? All right. No one likes a thermometer there, sweetie. Honestly, no one. Hey. Oh! Gwinny, goodness gracious.
Yeah, the seals do it all the time.
Do they?
Yeah.
Lovely. No one can ever say that our job is particularly glamorous. And here I am at the Seal Sanctuary, scrabbling around on the floor with a colleague, very close, very intimate. Claire's doing a fantastic job as I'm trying to take little Gwinny's temperature. And then Gwinny lets off an interesting noise. Definitely wasn't Claire. So just getting a temperature there, it's 38.9, which is actually quite worrying. The average temperature for a seal is about 37. So nearly 2 degrees above that means that she is suffering likely with a fever. So she's even more unwell than we first thought. All right, so I'm just going to check all the flippers then. I'm just going to check that wounded flipper. This wound does look quite a lot worse than it did on the beach. It's quite deep. It looks quite infected. There's a little tiny bite there and a larger bite there. So I suggest that this is definitely a seal bite. There's sort of a canine hole and then a premolar hole. There's 3 deep wounds on Gwinny's left rear flipper, and they really look very painful and very sore. There's a little bit of pus coming out of one of them. There is a distinct possibility that little Gwinny could be suffering with a condition known as osteomyelitis, which is infection of the actual bone. Because these bites are so deep, they can penetrate right down and into the bone, and this could lead to a blood infection known as septicemia, and that could have dire consequences for the future of little Gwinny. So Claire, lots of these seal pups that come in have these pretty extensive bite wounds.
The adults will defend their space, and if the pups don't move out of the way or get caught in the middle of it, then they can be the casualties.
Okay, so now it's blood sampling time. The concern of taking a blood sample from a seal is that you actually have to put the needle pretty much hovering over the spinal cord. Now, in a dog or a cat, you can take it from the jugular vein, so in their neck or in their front limb. That's not the case with seals, so it's quite nerve-wracking because you go in a little bit too far and you can irreparably injure the seal you're trying to save. Okay, good girl. Excellent. Okay, good. Okay. It's always quite a nerve-wracking moment because that needle is very close to the seal's spine, and the spinal cord is pretty important. I think we all can agree. So we'll send that to the lab and we'll just see how healthy or not she is, and we can start the course of treatment.
Yeah, sounds good.
Okay, so hydration time again. So, okay, come on. Fluids at this stage of her hospitalization are incredibly important, so it's only really once you're fully hydrated we actually develop an appetite. Okay.
regurgitated.
Not very clever, is it?
I don't know about you, but I'm a little bit concerned about her.
Yeah.
There we go. No. Sorry, sweetie, you're not ready yet. She really doesn't look well at all. She's very weak, she's very flat, and quite frankly, she looks lonely and sad. And I really do hope that she pulls through. We'll be back soon. So now I'm down here in Cornwall. It seems like word's got out a bit that there is a vet for hire. So I've just had a phone call from a wildlife enthusiast who's got a couple of patients that he wants me to take a look at.
Morning, sweet cheeks. Breakfast. Hello. Who's a good girl?
Gary Zammit is the head ranger at Feed and Farm, which is dedicated to the care and protection of indigenous UK wildlife.
Good morning, Rodney.
He's invited Scott today to help with 2 of his rescue rooks.
What are you doing? The great thing about rooks is they're intelligent, they're extremely affectionate, and they're one of our really beautiful native birds in Britain.
Hi there, Gary.
Hello,
How
nice
are you?
to meet you.
Good to meet you. I'm Scott.
Cheers.
And who's this awesome creature?
This is Rodney. So this is
Rodney.
One of our rooks that won't need any of your attention today.
Yes, well, he's looking
fine.
very healthy. I mean, it's very clear. Rooks are part of the crow family, aren't they? With magpies and ravens and things.
Yeah, that's right, yeah. And so they're very, very smart, aren't you?
And normally, you think of them as a wild animal. So why is this guy on your wrist?
Well, they're all rescues that can't be released. So this one was actually found when a tree blew down in a storm, and he was the only chick found alive. And so he was reared from a tiny baby. So he's totally what we call imprinted, so he thinks he's human.
Hence the human name.
Yes, hence the human name, Rodney.
Yeah.
You're handsome, aren't you?
Will you come and say hi to the vet? Will you? Oh, you're taking a little nibble out of the vet. Well,
Put your
luckily
hand
I'm not
behind
here
him.
to see you.
Put your hand behind him, he'll probably step up.
Hello, mate. Wow, he is gorgeous, isn't he? All right then, Rodney, you're going to come and introduce me to the team? Yeah? Shall we go? Come on then. Come on then, buddy. Come on this way. Here we go. Come on. Hey. Hello, guys.
Hello, sweet cheeks. Come on then, what have they got for you?
The first patient is a rook called Sweet Cheeks, who was rescued after living most of its life in a cramped cage.
So here they come, I can just go. Good girl, gotcha. Good girl. I can have a little tea towel. Just cover her eyes.
Yeah.
That'll calm her down a little bit. Sweet Cheeks is probably one of the worst cases I've ever seen. When we got to the house to collect her, the whole place was absolutely filthy. There was a cage jammed in a dark, dingy room with cats climbing over it. And when we got her out of the cage to have a look at her, we saw the deformed beak, the deformed legs and feet, and she was just a mess, basically.
But I can see that malocclusion there and that they're not actually lined up correctly, which is why we're seeing this knot wearing down.
Mm-hmm.
Okay, we just need to trim that end off, don't we?
Yep.
Poor girl. And just whilst we're there, can I just have a look at these feet? Oh, bless her, look at those. Really are mangled, aren't they? Poor little Sweet Cheeks, eh? Deformed beak, and then this incredible disability of these 2 club feet, but it doesn't seem to be affecting her. She's eating and happy just like the other ones?
Yeah, she took a long time to settle in, mainly because she was terrified to leave the cage that she'd lived in for 8 years.
So as this one's the one curling over the top, clearly it's not touching at all on the floor, which is why they're growing so long. But I quite like to have a cue as to how long a natural rook's nail is. So I might just see if Rodney wants to come and help me with that. Okay. Come here, mate. Do you want to come and model your feet? Never thought you'd be a foot model, did you? Good boy. That's a good lad. Right, let's have a look at your nails. Okay. So just looking at little Rodney's nails, they're about a centimetre and a half or so. So that's a good guide for Sweet Cheeks, isn't it? Yeah, it is. Yeah. Do you want to do it? No? Okay, I'll do it. All right. Okay, good boy. Say to about there. Try that. Okay, good. So poor little Sweet Cheeks is suffering with these very long nails because she's got these very deformed feet. She's had an awful life up to now until she's come to be in Gary's loving arms. And the toes are very deformed, and so the nails aren't wearing naturally on the ground or on perches, and as a result they overgrow, which is why we need to trim them. Good, that's good, I'm happy with that. Rodney, what do you think? Hey? I think you probably could have done better. Hey, all right, so now for that beak. About there, what do you think? All right, sweet cheeks. That's it.
There you go. I know, it's okay.
This side is really off to the left here, so all that is just deviating off to the right, clearly just not rubbing the way it should. Rodney, I'm trying to work.
He wants his attention.
I'm nearly there. This is twinging my perfection gene, so I just want to make her beak look absolutely perfect. It does look so much better already. Look at that. Ta-da!
That's better, isn't it? Oh, I know.
What do you think, sweet cheeks? I think that's rook for unimpressed.
Yeah, I don't think she's impressed at all, are you? Good girl.
Good girl. Well done. All right.
That looks a lot better.
Oh, clip nails, sorted out beak so she can go.
Good
girl. Well done.
Come on in. Easy, easy, easy. There you go. Oh, that looks better, doesn't it?
Oh, thanks, Rodney, for the present there. Hey, didn't they say something about it's good luck to be pooed on by a bird? I think that's what people that haven't been pooed on say. Yeah.
Ow, that's not very nice, Nelson, is it?
Gary's next patient for Scott is Nelson, who has a far more serious problem with his wing.
There we go. Nelson was brought here by a lady who found him just running along a road with one wing drooping. And when she got closer, realised that Nelson couldn't actually take off. Nelson's wing just seems to have drooped more and more with time. And unfortunately, it's getting to the stage now where it's tripping over the wing gets tangled. And then you have the dilemma, do you just euthanize it or do you see what you can do?
Just have a good feel. So you've just been trimming the feathers just because she's been tripping over them?
Yeah, it just takes the weight off it a bit.
It just feels quite wasted, so sort of a section of muscles called patagium, and it's maybe it's been affected at some point, so rather than there being an obvious break, it's just weakness, and so the wing has just dropped down.
Yep.
But unfortunately, that muscular structure also contains nerves, and if the nerves are irreparably damaged, then unfortunately never will this rook be able to use the wing properly. What I do think is that he suffered a neurological injury. There's something called a patagium, which is basically a sort of a thickening of nerves and tendinous structures that runs down from the shoulder all the way to the wrist joint, the metacarpal. And I wonder if he suffered an injury there, it's damaged the nerves irreparably, and now he can't move his wing properly. Therefore, I would actually suggest amputation, removing the wing completely.
He's never going to be releasable, but I just feel with the wing gone, his quality of life's going to be better.
All right, let's put this boy in the box.
Okay. There she goes.
Okay, Gary.
All right.
Let's go.
The reality is it might sound harsh taking a wing off, but the wing's doing nothing at all apart from making Nelson's life more difficult. And Nelson could have another 30 years or so. So we want to make those 30 years as comfortable as possible.
Scott will perform the delicate surgery with a new team at a local vet clinic.
Come on then, Nelson.
Thank you.
Sit.
Okay.
Let's go. Come on in. Hello, everyone.
Afternoon.
Hey, gang. Hi, I'm Scott.
Hi, Steve.
Hi, Steve. Nice to meet you.
Yeah.
This is Gary.
Hi, Gary.
And this
Nice
is
to
my
meet you.
rook patient, Nelson, who needs a wing amputation.
Okay. I think Claire's in the prep room ready for you, so if you want to go through, it's perfect.
Great. All right.
Thank you very much.
Thanks very much. Come on. Let's go.
I've drawn up the drugs ready to go there. All right, so ready to
Waiting to assist Scott are vet nurses Tash and Claire.
X-ray and then prep afterwards.
Well, hello.
Hi.
Hi, I'm Scott. How you going?
Hi, nice to meet you.
Claire, hello.
Hi, Tash.
Hi, Tash. How are you? So this is Gary.
Nice to meet you.
And Gary has our rook patient, okay? So Nelson needs a wing amputation. So if you pop him up there and say your goodbyes.
Okay. See you later, Nelson. Yeah, he's nice and calm.
Okay.
There you go.
All right, take it easy. We'll see you on the other side.
Okay,
All right.
thanks.
Cheers, Gary.
Cheers.
Where are you, mate? There you are. There you are. I've got you. I've got you. It's okay. 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 Okay, I've got him. Shh. Yeah, got him. There he is. Isn't he incredible?
Yeah.
That, as we know, anaesthetics in birds can be quite risky. This guy seems pretty chilled, however.
He's really calm, isn't he?
He's really calm, and hopefully we'll all be cool, calm, and collected. One of the big things with bird anaesthetics is that we need to just do everything as quickly as possible because they're very delicate creatures. We want the anaesthetic to be short and we want them to wake up quickly. So everything needs to move at pace. So this smells gross, all right? But then you'll wake up feeling much better. Actually, that seems pretty good fit, actually. So I'd let you know when he's going a little limp. I'll know that because he's really got good hold of my finger.
Are you that in?
Yep, he's going a little limp there.
With Nelson now under anaesthetic.
Okay, all right, happy, Tash? All right, let's go.
Scott can get an X-ray of the bird's damaged wing.
That is just the weirdest thing I've ever seen. Where's this bit of bone gone, Nelson? Hey? I'm really perplexed by what I'm seeing because he doesn't have a part of his humerus. It is literally not on this X-ray. It's so unbelievably weird. I really don't know why or how that's happened. All I know is it's going to make the amputation easier because he doesn't even have bone to cut through. So, happy days, but super weird. So, ladies, a little bit of a turn up for the books in that the humerus already has a gap in it. So, I thought it was very strange when I was feeling it then, but that's clearly why he's not been able to use his wing because it's simply not attached to the rest of his body.
At least there's a good reason for it.
Yeah.
Yeah,
and it means less work for us.
Yeah, perfect.
Yeah. All right.
Okay.
I'm going to get changed into my vet gear.
Okay.
You guys keep bucking. All right.
Okay, he's stable. He's got really good sound, strong heartbeat. Regular.
Brilliant.
That's good.
Good.
You happy?
Struggling to hear. Just pop the light there.
Just turn the ISO off if you think so.
Seconds later, Nelson's heartbeat has dropped alarmingly.
You just go quite right round the side. Just can't hear it. I'm struggling to hear.
In Cornwall, the operation to remove Nelson the rook's wing has taken an alarming turn.
I just can't hear it. I don't know whether it's just my hearing, if it's that light.
As we're desperately waiting to hear from Tash that she can hear Nelson's heartbeat, just time starts to stand still and every moment feels like hours.
I don't know if I can just hear machines. Yeah. Turn the ISO off.
Just turn the ISO off. Hear anything?
Can you hear anything?
Now that Nelson's struggling under the anaesthetic and we can't hear his heartbeat, we turn the anaesthetic off. So hopefully he'll start to lighten up, but it does take quite some time before we can hear any heartbeat at all. Happy? Right. Okay. So unfortunately, my friend, I'd have much more finesse than normally, but this is not going to be my prettiest. I think Nelson was in a whisper of death, honestly. Like he was just so close to not coming back. And anaesthetics in birds are risky. So we'll just skin there. Okay, so this will be the sore bit. Oh.
Okay, right, I'm going to put him back to 3.
As I start to move forward with the surgery, Nelson's anaesthetic again takes a turn and he starts to wake up. Is that a mask?
Yeah, here we go. Right, get back in there, mister.
We react by increasing the anaesthetic and then it goes down again, but it's a hell of a roller coaster ride. Okay, girls. Okay, you ready?
Yep. Yep.
There we go.
Okay.
Off.
Yeah.
Right. Okay, Claire, you still happy?
Yep.
So that's the last stitch, so let's wake him up. I don't know about you two, but I nearly had a heart attack doing that.
Yeah, pretty scary anaesthetics, yeah.
Wow, we did warn Gary. I don't know if we warned ourselves.
No.
Like we come, supposed to be the harbingers of death. We want him to see the light. Come back towards the light. Come on.
The shock sometimes that can kill them after the operation,
right.
which is the recovery is sometimes the more risky part, isn't it?
Yeah. Nelson.
Yeah, he's coming. He's coming.
Okay, mate, come on in. That was hellishly stressful. And honestly, I feel like we've literally saved this guy's life a couple of times during this procedure. And now, hopefully, if he comes through this anaesthetic, he's going to make a full recovery. Yeah. So I think we can all feel very proud. Here we go.
His eyes are open. His eyes are open. Look at that. He's a fighter.
Say hi.
Feel better now.
Hey, you must say thank you to the girls. Hey, thank you for saving my life. Hey? Hey, you've given all of us grey hairs. And yes, you have. A truly incredible experience has happened here in Cornwall with this rook because it was a very short anaesthetic on a bird that needed a surgery. It was absolutely right to do it. But to go through it with strangers and come out of it with 2 new friends and a rook that survived without the wing that it didn't need, it's an absolute miracle. So here he is.
Looking a bit smaller.
Yes. So the girls and I have just completed an amputation, so you can just see the site under there. The girls did an amazing job at plucking. So, and Gary, I've got some very odd news for you in that actually he was missing a piece of his upper forearm. So his wing wasn't actually attached to his body. It was only attached by skin and sinew and muscle. But the bone literally disappeared. I don't know where it is, but it's not in your bird.
All right.
But after some, shall we say, anaesthetic challenges, girls, we'll just leave it at that.
Yeah.
Anaesthetic challenges,
Right.
we've managed to get your boy through and we're just
Brilliant.
chuffed for you. We're
that's
very,
brilliant.
very proud of ourselves and of him. And now we want you to take him home and give him lots of love.
Brilliant. That's
All right.
lovely. Thank you.
Okay, let's pop you in. Good boy. All right, in you go, lad. In you go, lad. That's it. Good lad, good boy. The girls and I are going to the pub. Seriously, pub.
We've been promised a beer.
Yeah, at least one. You've earned it.
Brilliant.
Right.
Thank you.
Cheers, Gary.
Lovely.
Good on you, mate.
Thanks a lot.
All the best.
Cheers. Thank you.
We'll come and visit him. He's only up the road, so.
Yeah, please do.
Bless him.
Cheers. Thank
Bye.
you.
Okay.
All right then. Come on then.
Bye, Nelson.
Bye, Nelson.
Bye.
Oh, right. I'm never doing a rook anaesthetic ever again.
Nor am I.
Although, can I say, girls, high five.
Come on then, Dotty.
Back in St Margaret's, receptionist Elle is bringing in her newly adopted dachshund Dotty for an important first health check with vet Phoebe.
Oh, hello. Hello. We've come to meet you today for our general health check. Shall we come out of the bag? Let me put the bag down and we'll get her out safely.
Dotty's welcoming committee is practice manager Maz and receptionist Lizzie.
Oh, you little sausage. Oh. Can have a cuddle.
Cuddle. Cuddle. Oh, no. Dotty. Oh, hi.
I think Dotty and I have stolen each other's hearts. There's something about her, and I can see why Elle has just fallen in love with her, because she's just got this little spirit, and oh yeah, she's just delicious. Just delicious.
The 6-month-old rescue dog was found malnourished in a truck full of puppies that had come from Europe. And Elle wants to make sure she doesn't have any health problems.
She's so thin, isn't she?
I know. She was thinner than that.
Really?
Yeah. She eats like a little horse, though. She's got a good appetite.
Has she?
Yeah.
Good.
Loves everything.
There it is. Doggy girl.
What's going on here? Who else is here? Who's this?
Who's... Oh, hello. I hope you've got waterproof makeup on.
Maz, move out of the way. I need some time.
Go on then. Go on then.
Oh, Alice is Dotty.
Oh, is she going to nuzzle under?
Hello. Come on then. Come in too well.
All right.
Bye, baby. See you later.
Come on, Dotty.
She's ridiculously cute, isn't
She's so cute. I'm going to wait here till she comes out.
Right then, let me have a little look at her. What we tend to look out for is if she goes in at the waist, which she certainly does, and you can actually see her ribs, and that means that she's a little bit underweight, so put on a little bit more weight and then she'll be perfect, I think.
I think she'll be happy with that.
Yeah, obviously we want to keep her as slim as possible because it will have negative effects on her joints and things if she's overweight. So I assume she's been eating well then.
Eating really well.
Those lovely little teeth.
Yeah, it looks like she's got some adult teeth coming through.
How exciting.
Right then, time to listen to your heart. Here we go, you look at mummy.
Good girl. As Phoebe is listening to her heart, it all goes a bit quiet, and I'm thinking, what has she found? Okay, Phoebe?
That all sounds fine.
Oh, good.
Yeah, nice regular rate and rhythm. So.
Okay, fantastic.
Elle's quite clued up with dogs, obviously, from working in a practice. She knows what she's getting into, and she knows that dachshunds have issues with spines as well. So that's another thing that she'd like me to check today. The most important things you can do at home are to minimise any sort of big jumps. So try and stop her jumping on and off the sofa and try and avoid stairs if you can as well.
Yeah.
And the other most important thing is keeping her slim, because obviously that will put less pressure on her joints as well.
Okay.
Because the spinal cord obviously runs all the way down the middle of the spine. Sometimes they can get nerve deficits. So one of the ways we test that is by just seeing if she knows where her paws are. So you turn it over and then she corrects
wow.
it. So she knows where her feet are. That's a good sign.
Thank goodness, Dot. Dotty, is it time to get back in your bag? Time to go home now? Oh, I'll go and get her bag, Phoebe, if you could just hold her.
Okay, I'm just going to have one last little cuddle.
Okay.
I don't know what it is that makes Dotty so cute. Maybe it's her massive ears, maybe it's her tiny little legs, or maybe it's just her personality capturing everyone's hearts.
Oh, Phoebe, thank you so much for today.
That's okay.
Very reassuring to know that she's fine and all the things I need to look out for.
Definitely. She's doing really, really well. I'm sure she's got many, many happy years ahead with you.
I'm sure. Come on then, Dotty, let's go. There, you're going to stay in? Come on then. Bye, Phoebe.
Bye.
In Cornwall, severe weather is continuing to take its toll on the local seal population. Scott has been helping out at the Cornish Seal Sanctuary Hospital, and rescuer Dan has arrived with another patient that needs immediate care.
She's a little bit on the small side, she's only 14 kilos. Here's her paperwork here from when she was picked up.
Yeah, so she's quite a young one then. Hello, gorgeous.
She is.
And what's her name?
Her name is Fortune.
Now, Dan, I must say, I've seen some varied coloured seals. I've never seen a yellow one before.
She had a little accident in the cage on the way down,
well,
and she's covered herself.
Right, a lot of people get travel sickness, so we won't blame you, sweetheart. Never mind. Okay. So straight away I can see a little bit of discharge from the nose there, so she has got a mild respiratory infection, it seems. Cold and flu season for us and cold and flu season for seals.
It can be, yeah. Absolutely.
And then obviously by having a respiratory infection, they can't breathe properly, so they can't dive properly, so they can't eat properly, which is why you then find them washed up on a beach.
Yeah, exactly. So she's 14 kilos, she's about 5 weeks old now. She should be double that weight, ideally.
All right, well, I think she's in desperate need of some hospital care, so I'm going to don the outfit to just do the quick avian flu test, and then we can get her into the hospital.
Sure, great.
Okay.
Scott needs to check Fortune for the highly contagious, deadly avian flu virus. If she is carrying it, she won't be able to be treated up in the hospital.
All right, so...
Oh, nice.
Lovely. Thank you very much. I was going to actually put a swab in her nose. I should have just caught it with my face.
She's giving you a sample.
Yeah, she really was.
That looks like it's okay. I think, yeah, we got it inside.
Yeah?
Yeah.
Good girl. Bit of seal snot, yeah?
So there's a saying, make haste slowly, and that's exactly what we have to do with these rescue seals. Yes, they need urgent care, but if we rush them into the hospital and they have contagious diseases, they can spread it to some of the others.
Okay, so very good news there, Dan. Only one line, so no avian flu.
All clear?
All right, yep. So I'm going to get out of this incredible outfit and let's get her into the hospital, shall we?
All right, let's go.
She needs our help. Go round here to Auntie Claire. There she is.
Hey, Claire.
Hey.
So we've got a young female. She's quite underweight and she's got a wound on her right hind flipper and she doesn't have avian flu, so all good. There you go, sweetie.
Finally, I can get to grips with Fortune. Now she's able to be admitted into the hospital. I can check this poor girl over and see what injuries she's suffering with.
Yeah, she's certainly not got anywhere near the fight that some of the others have.
No, she hasn't got the strength, which is probably because she's so skinny and not been eating for a wee while.
Yeah, the temperature's 36.4, so just slightly low, but at least it's not high, so she doesn't have an active systemic infection, so that's good. So
This right flipper, straight away I can feel like it's very swollen and actually quite hot to the touch.
Right.
So no surprise if there's an abscess lurking in there somewhere. So what I found here is just the exit wound of what looks like a bite wound. So she sustained an injury while she's been out and about, and then the wound's healed. She then got an abscess, which is broken open on the underside of her flipper. So just as a dog or a cat, particularly cats, get cat fight abscesses and they turn very nasty very quickly, the same's applied for little Fortune.
When Scott first saw Fortune in the car park, he was concerned about discharge from her nose.
Chest doesn't sound too bad. So I think it probably is an upper respiratory infection rather than a more serious lung infection.
Actually, her breathing's not too laboured, so hopefully it's just minor.
Yeah. Right. So hydration time. So they've got the same gap between the teeth that a dog has. So you're going with your fingers to get a worming tablet in. That hose must be quite uncomfortable, but it's all very important stuff, isn't it, to rehydrate them?
Yeah, I bet it's not the most comfortable, but she'll thank me in the long run for it.
Yeah, for sure. Yeah, she'll be parched. She needs a good drink.
Yeah.
So now that we've rehydrated little Fortune, the last thing I need to do is to give her some medical treatment. And what she really needs is very similar to how we treat a cat with a cat bite abscess. She needs antibiotics and she needs some pain relief in the form of anti-inflammatories. So I'm going to give her 2 injections, which aren't very nice. They have to go into the muscle, but it's all important to get her to start feeling better.
Okay. Well, Fortune, I think your fortunes are looking up, my girl. Yes.
I'm really hopeful that she'll return back out into the wild after the infection's cleared and that she's gained that much needed weight. As soon as she starts feeding for herself and really, really guzzling the fish down and competing well with the others, I'm sure she'll be fine.
Even though you're pretty feisty. But feisty's good. That's what we've learned. Feisty's good.
Good morning, Nelson. How are you doing? There you go. Good.
Next morning, over at Feed and Farm, Nelson the Rook is recovering well from his amputation surgery.
You're looking good, aren't you? Have some breakfast.
Hey there, Gary.
Oh, morning.
How are you?
Yeah, good.
Right.
Yeah.
How's my Rook patient doing?
Brilliant. No, really, really good.
Mate? Oh, he looks fantastic, doesn't he?
Yeah, so much more comfortable looking now.
Yeah.
During a tense surgery, Scott had to remove Nelson's deformed wing.
Today, Nelson is looking absolutely fantastic. You would never know that he's been through quite the bumpy ride that he has, and he seems fighting fit.
That's it. And then there's that little suture line in there. Looking good. Very small, really.
Yeah, I'm surprised how small that wound is.
Right, mate. You can go and see your mates, hey? Go and find that girlfriend of yours, hey? Come on, then. Let's go.
Good boy.
Hello, team. Hello, Rodney. Hello, champ. Look, we got your buddy back. Look. Look. Hi. How are you this morning? Hello. Look. Look, it's Nelson. There he is. There's your buddy. There he is.
Yeah.
All right, Nelson. You go find your girlfriend now, buddy. Okay. And there he is. Fantastic.
It's great, isn't it?
Yeah.
So, that's his mate there calling now.
Gary, thanks so much for the opportunity to perform this procedure on your rooks and for sharing your passion, because now, being with these guys just for a couple of days, I can really see where that passion comes from. They're awesome.
That's great. No, thank you. I mean, Nelson there's looking great. He's going to be a lot more comfortable.
Yeah.
And Sweet Cheeks Beak's looking great. And yeah, it is amazing how once you spend a little bit of time with the species that you might not think much of before, it changes your attitude. And that's the whole point of what we do.
You all right, Rodney? Do you want to come home with me? You're pretty cool.
And he is a bit of a star, isn't he?
Oh, he's a ledge.
It's Scott's last day at the Cornish Seal Sanctuary, and he has a special treat for Gwinny, the first seal pup he helped rescue a few days ago.
Look what I've got. Look, what you think? What you think? Oh, clever girl. Well done. Someone's got her appetite back, haven't they?
It's incredible to see the wild instincts coming back through with this beautiful little seal pup. Gwinny's ripping away at this fish ferociously, just like a seal would in the wild. So I'm really hopeful that she is going to make a full recovery.
All right, Gwinny, you be a good girl. Stay in there and get well soon. Good girl. Well done. Good girl. That's it.
Hopefully, both Gwinny and Fortune will eventually be moved to these outside pools to continue their convalescence. Before Scott heads off, Claire wants to introduce him to Ray, one of the sanctuary's long-term residents.
Ray!
Hello, mate. He's incredible, isn't he?
Yeah, he's great, so...
Hello, big boy.
And if you call him, he'll come a little bit forward.
Come here, mate. Here you go, big boy. There you go. Good boy, that's it. Well done. Good lad. Oh, he's such an incredible boy, isn't he?
He is. He's a rescue from back in 2001. Sadly, we think he suffered a blow to the head before he was rescued, resulting in him being completely blind.
Oh, there you go, mate. Well, certainly no issue with him eating, so he can feel the fish coming towards him with his whiskers, can't he?
Yeah, exactly. And luckily, he recognises his own name, so we can give him a little bit of extra fish while the rest are busy eating.
Well, thank you so much for that. That's such a special experience. I do hope that Ray looks after our little Gwinny.
I'm sure he will, yeah. He's a very sweet character. So he's...
Hello. You better be sweet as well. Hey? Her name's Gwinny. She's very sweet. She's very beautiful. Don't be too jealous. All right, Claire. Well, thank you so much for letting me come here and work with you. It's been amazing.
Well, thank you so much for all your help.
Oh, you're so welcome. All right, then. Bye, guys. Take care, Claire.
See you later.
Bye.
It's been an incredibly special week being down here in Cornwall, a county that I absolutely love. And I've really reminded myself of just how feisty and fun British wildlife are, from the pecky rooks to the slightly snappy seals. And I think I've been reminded of how much British wildlife reminds me of British people, tough and resilient.
And 4 months later, there's some good news from Cornwall. Gwinny has been nursed back to full health. She's put on weight and her infected bite wounds have fully healed. So today she's being released, along with 6 other rescue seals that have also completed their recuperation.
It's the best feeling in the world. It sounds really corny and really cheesy, but when you see them when they're so ill or so vulnerable when they come in and you build them up and you're releasing them at 30, 35 kilos and they're just this big, healthy pup, it's just fantastic to see them disappear back out into the sea and hopefully be fine.